Okay? All right. So why isn't everyone using this level of protection? Why isn't it the ADA required? Or basically, what's your excuse going to be? Because I know how dentists think. We procrastinate. We don't want to spend the money. We go to a seminar and get fired up and say we're going to put stuff in place, and about half of it gets done. So that's just our human nature. Now, this barrier protection is not official IAOMT suggested technique. It's provisionally approved in a scientific review. It will probably be approved. We have different levels in our scientific review as soon as we get it published. And it may become requirements for accreditation, but it's not there yet. What is required for accreditation is the patient protection with the nasal masks, the rubber dams, the auxiliary suctions, the cleanup. And for yourself as a doctor, you need to have a respirator mask on and the assistant. And you're also required to have a separator in your office. Yes? Well, only two I know of are the ones we standardly use and the cleanup. And I think you have to use cleanup for accreditation. Now, rubber dam, yes. Now, you can ask the accreditation committee specifically, but I think that's what they require. Okay? So, and more studies are needed to determine our best barrier protection. You know, is there a better piece of material to use? So, you know, if you're using anything protecting for a virus or surgical scrub, or then I think you're in good shape for right now. But they don't. None of them 100% block vapor. All right, face it. The gowns are uncomfortable. They're not as uncomfortable as mercury poisoning, but they're uncomfortable. They're hot. You sweat. You don't want to have them on any long as possible. But I wear them. Our data has not been published. I skipped most of it for this procedure. It's volumes of data. In fact, it's mind-boggling. And other dentists, they don't know what they don't know. So if you're discussing it with other dentists, they're going to tell you, look at you with deer in the headlight look and tell you, what are you talking about? You're crazy. All right. So, I don't want you to think you're bulletproof. You know, I've been at this little game for 31 years now. Is that right? 31, 32. I've had 2 heart attacks. I'm diabetic, under control. I live a healthy lifestyle. I'm not a drunk. Don't take drugs. But I've got damage from mercury. And so all you younger guys out there have a really good chance of not having chronic health problems due to mercury. And you're probably going, well, how do you know it's from mercury? So, I've had these questions asked during the breaks. How do I know my office is clean now? Is it a mercury waste dump? You can rent a Jerome mercury vapor analyzer to test your office from azic.com. I'm not sure how much it costs to rent them, but it's a lot cheaper than paying $15,000, $20,000 for them if you want to. If you need to decontaminate your office, you can use flowers of sulfur, and this is a product you can buy, or Mercon decontamination products to wipe out shelves, surfaces, autoclaves. If you have any mercury in the office, get rid of it. Any unused amalgam, it's all constantly leaking. It's not contained in the capsules. If you've got carpeting, you're going to need to get rid of it and replace it with some kind of hard surface floors that don't have cracks in them. They're easier to keep clean. If you have drapes or other fabrics that have been contaminated, they just have to go. When we were doing this study in my old office, where we did all this study, where we created all the data, it used to be a teaching room. And so it was a room that was 40 feet long. It had 2 chairs in it. The chairs were partitioned by more solid, like a big solid piece of furniture. And there was a teaching island in the middle. And then there was a really nice 10 by 10 woolen rug that was a very expensive rug that covered the floor between those 2 operatories. So it was like 3 rooms with 2 chairs in it. And when we started getting our pre-levels of mercury contamination in the office, everything was low. We weren't picking anything up until we tested the carpet. And the carpet, my daughter wanted the carpet, or the rug, the bound rug. And I told her, well, if it tests good, you can have it. If not, it's in the trash. So we tested it. We got a picture of us rolling that thing up, throwing that $3,000 bound carpet in the dumpster. It was full of mercury. And how did it get there? It either floated over there, or we tracked it with our feet over there, or the air conditioning system carried it there. So you need to get rid of all fabrics in your operatories. You just have to test it. It's probably got mercury in it. I mean, it probably actually does. Just from your feet and tracking it out there. I recommend no fabrics in the operatory or in the back parts of your office, around your operatories. Out in your waiting area, it's probably fine. We got a few rugs out there. My office is all porcelain tile. Now, new office. You just can't keep them clean. And even back in the 1976 June Journal, they talk about how bad the carpets were in that thing. And that thing's, you can't even get that. They won't even reprint it for me. It's like we should have never done this journal. But I've got copies of the articles because one of our members had the journal. So, are y'all going to be Superman and think you can inhale mercury and excrete it 100%? Some of you can, if you got the right genes. So how do you determine your heavy metal load or for your patients? What can you do? What are you legally probably able to do? So testing for mercury levels in humans is it's kind of tricky. The half-life of mercury in the blood is quite short. It really only lasts about 3 days. And the currently used blood test, if you send it to a physician who doesn't know what he's doing, they test for mercury, it'll come back negative. Because it's not in the blood unless they've had a recent acute exposure. Urine levels of mercury, toxic individuals are usually kind of low because mercury is not naturally eliminated through the kidneys. Some is, but most of mercury is eliminated through the gut, in feces, through perspiration, and is exhaled. So you can do a challenge test where you actually give a mercury chelating drug. This test was done with DMPS challenge, and it showed that 66% of excreted mercury came from dental amalgams, and that the total urinary mercury correlated to the surface area of amalgams. And so basically, this is a test which we don't advise you to prescribe because it's more of a medical test, but you find a integrative health physician or a naturopath or somebody who knows how to chelate mercury, and you have them do this test. But this is what you tell your patients, you go get a challenge test. It can be with DMPS or DMSO, but it's some type of drug that has a sulfur group on it, basically.
So, you're saying this measures the amalgam that's released in dental amalgam, but what about occupational exposures?
That study just correlated the release with the number of amalgams. Okay? So, as far as your occupational exposure, obviously you probably don't have amalgams, so if you have, as a dentist, if you're having high mercury levels, I would think it's probably from occupational exposure. Okay? All right, in the 1975 through 1983, the ADA conducted DMSA challenge tests on 4,272 U.S. dentists. And their mean urine level was 14.2 micrograms. If you're not, the normal range is around 3. If you're not exposed, don't have occupational exposure, or don't have a lot of mercury, you're going to want to see that to be under 3 micrograms. So 19.1% were over 20, and almost 11% were over the CDC maximum acceptable level of 30. And I don't know where that 30 came from, because my physician says he wants it under 3. And then 5% were over 50, and at 50, you should be seeing some induced tremors if you have that much mercury. 1.3% were over 100, and these definitely were having tremors.
The DDS or DMSA challenge test doesn't always work out. In some cases, the mercury is so tightly bound in the tissue that it doesn't even come out. In fact, a friend of mine, who was a physician, that was so intent on finding mercury toxicity or mercury burden that the doctor performed over like 15 challenge tests. The 15 challenge tests, the patient got very sick and did excrete a large amount of mercury. So it doesn't always work 100%. The main thing to look for is exposure.
This is somewhat of a controversial test, too. And chelation, the treatment for removing mercury, you may go through some chelation, IV chelation, EDTA, whatever it is, or DMSA drug. It can be a suppository or IV, or orally combined with IV sedation. And you may see levels drop for a while. And then you stop, they may go back up. You have no way of knowing really how much burden you have. This is just gives you a starting point, basically. And if you're going to chelate, you want to see it at least go down. These are my tests. When I was, or some of my most recent tests, I mean, one time I was at 85, this was after 3 months of treatment, and I got down to 43. It took me a solid year of chelation therapy to get my levels down below 3. Below 3 micrograms per cc of creatinine. For a while I was going once a week, twice a month, then I went for maybe once a month. IV? I think the oral chelator was DMSA. I think is what I was taking, if I remember right. You also had lead, cadmium, arsenic. So this is where I got my mercury back down to 1.3. But it took a year to do that. All right, there's some other tests available we can use as a screening test. I want to emphasize again that the challenge test with some kind of mercury drug chelator, prescription drug, should refer that to a qualified physician. Not really in your realm. You can get in trouble with your state boards. Some dentists do it, get away with it, but we definitely, as an academy, caution you not to. Neuroscience Mercury-Free test is Chris Shade's product, and Chris, I think, is doing some of the breakouts because we had some people who didn't come at the last minute, and I think Chris Shade is coming. He'll be talking about this test. It's a newer blood test developed by Chris, and his company is Quicksilver Scientific. It quantitates and qualifies types of mercury from blood. I think it's more like a photospectrometer test. That's how he does it. He's got the science behind it, and it's pretty amazing. I will do this for my patients as a screening test. And the original test only did mercury. He's got a newer one that picks up a couple of other metals used in dentistry now. But I'll have to let Chris be the guy who explains that one. But I will prescribe this to my patient. And basically, it's a kit. You give it to the patient. They can go get the blood drawn at any lab that draws blood. And they send in some urine, and they send in hair by the directions in the kit. I can't remember if, I don't know if I pay for the kit first and then they pay me on this one, or if they just pay Chris, but I just charge what the kit costs. And it gives a good, just a good screening test. Some patients need that to be motivated. They want to know if they really have a problem before they remove their mercury. Some of them have already had it out, and they just want to know where their levels are. Should they go seek chelation? But they don't want to go do all the blood work for the chelation doctor yet. And this is a relatively inexpensive test. I think it's about $389. So I will give them this test to do. But I don't treat them. I don't chelate them. The urinary porphyrin test, well, that's the quicksilver test, where you get it. The porphyrins comes from Metametrics Clinical Laboratory. I think it's still available through them. And it looks at toxicants like heavy metals and xenobiotics that bind to one or more enzymes to produce specific patterns of urinary porphyrins, which are proteins basically that aren't supposed to be in the urine, but they're there in response to these environmental toxins. And each toxin gives a certain pattern that they're able to determine what's in the body. And these toxicants, these porphyrins, do cause tissue degradation. They're not good for the body. They appear elevated in the urine, and they block the cellular pathway for heme synthesis. So they're not good things to have around. And they can give you, whether it's from pesticides or from mercury, a couple of other patterns that show up. Of course, we're looking for the pattern from mercury. Dr. Kennedy's going to talk about fluoride this afternoon. Not yet, but this afternoon. And we would love to see our practices in IAOMT become fluoride-free. We just like you just stop giving fluoride. It might cost you a little bit of money, but it'll also attract a new breed of patients who are going to spend more money. And you'll hear the reasons for our stance on fluoride this afternoon. But we do try to use composites that are very low BPAs and don't release fluoride. These are two from Voco, Admira, or Grandio. Bill and I both use these. There's a diamond composite that's out there that meets our criteria too. So after you've been here, or when you're a member of the IAOMT, we're not a police organization. We're not going to kick you out. And we're not going to come police your offices. We do encourage you to do the accreditation process, so you'll learn more about this through this, and you'll make the decision yourself to place these protocols in place. But we would love to see everybody, I would love to see everybody fully implement them just for your health, your future health and your family and yourself. We'd love to see you become a fluoride-free practice, including eliminating fluoride-containing composites. I'd love to see that equipment installed, using protocols to protect the environment inside and outside your offices. That's what we want our members to represent in the IAOMT. We want you to be leaders in biological dentistry and communicate the difference to your patients, which is easy. To your colleagues, it's harder. Colleagues just don't want to listen. So, the only other thing I think I didn't mention, and I should, is for hygienists. What I do for my hygienists is they wear a mask, one of our mercury vapor masks, when they're polishing them, when they're doing the polish on the prophies. And we also tell the patient we're not polishing the surfaces of the amalgams whenever possible. Okay? And the other thing I didn't point out real clear, and I was talking about one of our ladies out there at lunch. Think about the assistant who's been working with mercury all day long, that leaves the office, same clothes she's had on all day long, picks up a child, or you go home, pick up your children, they give you a big old hug and bury that little face in your chest, and they're breathing a mouthful of mercury. That's why I think we need to be using these disposable protective items for ourselves. How many scuba divers we got in the office? Anybody? Dave? No, that's it. Man, usually tons of hands go up. Anyway, we're going to be in Puerto Rico in March. I'm probably going to be putting together a little pre-meeting scuba diving resort. And so if you know anybody, we'll be sending out emails on this. But that is one of my passions. Quick few minutes, any more questions? All right, Dr. Virtue, come on.
We need two of these.
Well, they just use them in other things.
They're not using the other one.
Probably downstairs.
Yeah, they've got so much going on today. We've got a couple of different
Oh, okay.
things.
All right. I'm crowned.
You were proud.
All right.
Let's make you look good.
Oh, yeah. That's important, too, you know. All right. Thank you, Joe. All right. I will try to get done quickly here because Dr. Kennedy's coming up, and he's going to really entertain you. You remember that telling you about Dr. Phillips, and everybody goes to sleep after the lecture? Now's the time. Okay. So, at any rate, this is just some things. I talked earlier about communicating in the biological dental practice. Joe took this picture of me down at his house in South Carolina a couple years ago because I told you my computer skills weren't great. I love paper maps. I don't know what it is about the GPS thing, but I'd really rather have a map, which you can't see. I was standing there looking at the map trying to figure out how to get home. But at any rate, that's why I took that. You're going to deal with a little bit different type of patient when you get into biological dentistry. I'm having trouble with my ear here. Let's see. I think we're okay now. And I used to consider them kooks and crazy, kind of like the IAOMT used to be. But these people are truly different. And they're different in the sense that they're very educated. They know more about this stuff than we do many times. And early on, that was very intimidating for me to have a patient come in and basically know more about their problem and or the dentistry I needed to do than I did. You know, I am the dentist. I know all this stuff. And how dare you, know more than I did. Well, you got to get over that one because these folks come in from the internet. We talked at lunch with an office that we're talking about the Equa service that I use as my internet host, I guess they're called. I'm not, I don't get into designing it. They do all that stuff and I just approve the information. But these people come in through your website. That's where they come. I do marketing for cosmetics. It's going to be basically on television, word of mouth. Radio is good for quadrant dentistry. People, older folks, children are gone and out of college and they got money. And that's a great way to get quadrant dentistry done. But if you want to do biological dentistry in my office, it's been very successful from the website. That's where they come from. These people have spent money, have seen everyone else looking for someone to listen. A lot of times you're going to hear, you're the first person that's really listened to me. Because I know they're not crazy. They're sick. They've got a lot of problems, neurological problems. Some of them can't work. Some of them are, function, but not on a very high level. And when you finally they realize that you care and you're interested and you know that they're not crazy, they really open up and they become great patients and great referral sources. So they're going to be different. Sometimes they come in with the all natural clothing or the longer skirts or the Birkenstocks, or they sometimes have a different look to them. But I mean, these folks are great patients. They truly are. So I just encourage you to kind of look at them differently, and they're not nuts. They've got a problem, as Stuart knows. These people are affected by this, and you can help them. Environmentally sensitive, we're real careful. I don't wear cologne in the office anyway, but they're very sensitive to perfume, scents. Some are very sensitive to fluorescent lighting. And you think, my goodness, you got to be crazy. But if your immune system is out of whack, there's a lot of things that affect you that you normally wouldn't be affected by. So understand that and just pay attention to what they want and what they need. And as I said, knowledgeable about mercury hygiene. You aren't going to fake these people out just because you put a dam on. And that's not going to get it. They know exact the protocol. They've been to the IAOMT website. They know exactly what you're supposed to do. And, you hear them mumbling underneath this dam. And you're going, well, what are you saying? They're wondering, do you have the vacuum under the dam? They know that's supposed to be there. And, they know it's not a rubber dam. It's a vinyl dam. So when they come in, they're looking around. They're looking at the equipment. Now, luckily, I have them go to my website, so they look at what I've got going on. They know I know what I'm talking about. And again, did I just shut off here? It sounded weird to me. Okay. I'm fellowed, so they look at that on the website, and they understand that if you're accredited or fellowed, they feel reasonably safe. The higher up, soon it'll be mastered. Then they just assume that you know what you're doing, and which is usually the case. Many have a diagnosis of MS, fibromyalgia, Lou Gehrig's, arthritis, headaches, chronic fatigue, Lyme's disease, a lot of Lyme's disease. I don't know what in your areas of the country, it's southeast, a lot of Lyme's disease. I don't know if it's just better diagnosed or the ticks are getting carried away, but there's a lot of folks suffer from that. This keeps sounding strange. Is it okay? Okay. All right. And other chronic diseases. And Joe said, Fibromyalgia, chronic fatigue is kind of fits into one thing. I don't know what's wrong with you, but you got fibromyalgia and probably heavy metal related. Unable to function, a lot of these people can't work. If they work, it's very minimally. Safe mercury hygiene takes more time, as Joe showed you with some of these new techniques we're looking at. You can imagine it takes longer to put the gown on. Even with these techniques that we're accredited with now, our phase 1, you might say, that with the dam and the regular mask and all that, you've got to purchase this stuff, you've got to put it on, you've got to go through the process, so it takes longer. It definitely does. So you got to charge a little bit more. Don't be ashamed of that. As Joe said, some of us charge by the quadrant, some of us just raised our fees across the board to cover what we're doing, but at one way or the other, figure out a way to get paid for it. You don't want to do it for free, and you shouldn't do it for free. Be prepared to spend more time, initial exam and diagnosis. Some of our people come in, they could be there 3 hours. Now, I'm not with them for 3 hours. I might be with them for 20 minutes. But they're going to be talking to an assistant for as long as they need. I mean, it's just you sitting there and they take photographs and they talk. And then I come in and then they tell me all this stuff and then I go to do my thing. But be prepared to spend time with them. Don't rush them. They've been to other dental offices and they've been to a lot of physicians. And what they really are looking for is somebody that cares and takes time with them. Every patient is treated with Mercury-Safe protocols. I don't care who they are. No one comes into my office and gets mercury filling removed without the protocols. We just do. Because we're protecting ourselves, too. You know, it's just not the patient. They're just there for a couple hours. The team of dentists always protect themselves. Like I say, we always wear the protective gear. This is a Clifford test. This is one of the tests you can use. Excuse me. A lot of these patients are sensitive to a lot of different dental materials. We don't know what it is. But this Clifford test has, I think, 4,500 or so dental materials. Excuse me for a second. Dry. And then you'll get back a response of N or S, meaning no or safe. And you go through your list of what you're going to use, and you can pick out different materials. Sometimes you can do an Empress, but you can't do an Emax. And just you have to change your treatment plan a little bit, depending on what the report comes back. But this is a very safe way of knowing, and Jeff Clifford will probably be here, usually at the meetings. This is a very safe way to knowing what to prescribe for the treatment. And I think this runs around $300. It's not terribly expensive. And again, the patient goes and gets some serum, gets some blood drawn, they send it down and send it off to the lab. And you get 2 reports, one for the patient and one for you. And this, of course, is in the notes here. This is Jeff Clifford. This is his lab. And great guy, very, very kind individual, and he should be here. Oh? Yeah. Right. Why can't you? What about a physician? Huh. That's a weird. Okay. Yeah, well, that's the first time I heard that. Wow. First time I heard it, I don't know. Okay. You can get around it. So you don't make a big deal out of it. You kind of have the test, but you don't show it. Yeah, well, we don't have... North Carolina is a very conservative board-wise, as I mentioned earlier, but we haven't had a problem with that. But, maybe we will. This is another company called Biocompatibility Testing and Dental Toxicity. There's a phone number there for them. Do basically the same thing. And this is just some stuff that the IAOMT has. A lot of these brochures have been updated. I think, is Amanda done with the new ZIF book? She should be. Does anybody know? Dave, do you know? Okay, it should be. Well, anyway, these books are available through the IAOMT. They're inexpensive, and I buy these and give it to my patients. Just interesting reading. New patient packet. You've always got some stuff in there to read. Again, this is Michael Ziff, our one of our founders, who's passed now, but great guy. His wife's still here, Peggy. This brilliant guy. He was really a treat to be around. Very unique individual. And this has just been updated and modernized. This book's probably 20 years old, David. Yeah. So it's been revised and up to standards. Some more books that we have through the academy that you can give away inexpensively. This Fluoride Deception, Dave will probably hit on this afternoon. Great book. And it's here. Leo's probably got that at the Dams book, but that's a really interesting book on the history of fluoride and how it got started in this country and some of the damage it does. And these are brochures that we have available at the Academy that you can donate to handling patients, and they can read up and understand a little bit better what you're saying. Because not everybody's on board with this, you know. The people who come in through the web and are wanting their mercury out, they don't need this. But some of the other people aren't quite sure. If you're going to do the whole quadrant and you got one filling or one tooth doesn't have yet decay around that mercury filling, or not, you can't detect it anyway. You know, you don't want to leave one black filling in there. Sometimes they'll ask, well, can't you leave that one? Well, yeah, I can, but you know, sometimes this information helps them, motivate them to get that last filling out of there. And cookies and hugs. You know, one of the advantages, and I don't mean to be economically all the time, but you know, God, I'm a businessman. I mean, I make business. I mean, I got rental properties and I invest a lot, and I'm a dentist, so you got to make money at what you're doing. But you know, you increase your patient pool due to unique selling position. In other words, nobody on your street's doing this yet. So, you know, in your community, if you're the first person to do it, I guarantee your colleagues aren't going to appreciate it, but I can guarantee your patients will appreciate it because they're hearing about this. We all know mercury is not good for us. It's in the news, and they're waiting for somebody that can remove this carefully. Now, a lot of times I have people come in and go, yeah, I got my mercury removed last year. And I go, well, really? How'd they do it? Well, they just took it out. It's like, oh, great. That's worse than leaving it. I mean, if you're just going to just rip it out of there without any precautions. But if you have the handle on doing this properly, you've really got a unique selling position. Staff retention, I think it's because of my charming personality, but my staff's been with me for 25, 30 years. I mean, they've been with me forever. I mean, if you're doing this properly and they're aware of what's going on, they're not about to go to some other dentist to go to work. Now, I may change professions and go to something else, but to go to another dentist that doesn't practice this protocol, you know, would be idiotic. They won't do it. They'll stay with you. And it's a safer work environment. They know that. And it's a win-win-win. Everybody's winning with this. Perceived increase in degree of professional excellence and increased in caring level of your patients. I mean, you're perceived as an expert. You know something other dentists don't know. You're doing something very different from other dentists. And it's a lot of fun. I mean, I love going to work and doing a quadrant of Cerax and getting out mercury. Increase in patient acceptance of restorative treatment plans. I mean, they want to get this work done. You know, it's not a question of, well, I don't know. It's like, when can I get it done? I mean, I said, well, you have to talk to Melinda at the front desk and see when we can get together because they're anxious to get this out of there. It's not a question of, well, then I'll wait for that to break. No, they're going to get it moved out. They pay cash many times. Many times they got to do some financing, but we don't do in-house financing anyway, but we always get paid one way or the other, or usually get paid. You got a healthy retirement, at least you're not sick from mercury poisoning, or shouldn't be if you're doing it right. Increased perception of excellence. You've got a very unique and different office. Increase in practice income, which in my office is shared by the staff. We have a bonus system that averages collections and gets back to the staff. They're guaranteed a base wage, but you know they make their money on their bonus. Recession-proof your practice. I mean, that's not really an issue. I don't know how many people have been affected, but I mean, it's just these people still come in. They still want this work done. Never diagnose, and Joe said this earlier, you'd never diagnose mercury poisoning or claim mercury poisoning from amalgam mercury exposure. The dental boards consider this practicing medicine without a license. I don't think you don't do this in any state. I never tell anybody they're going to get better. I never tell them mercury made them sick. I just say, look, obviously it's cracked your tooth. Obviously, you know, it's more toxic than arsenic and lead. What's it doing in your mouth? You know, let's get it out. And that's kind of the way I take it. And I just agree with them when they come in and say, this mercury is making me sick. I say, yeah, it probably is. Do not do chelation in the office. Some of the things we talked about are actually antioxidants that are probably borderline, but DMS and DMPS and DMSA are not something that dentists ought to be doing. And besides, it's pulling it out through your kidneys, which you don't want to do. You want to have it come through the gut. Do find an MD that treats heavy metal toxicity that you can refer patients. I've got 3 or 4 in the area that we refer back and forth. I send them folks. They send me a lot more than I send them. But the great way. I also write them a note telling them what I'm going to do and what day I'm going to do it on. So that if they require that patient to come back for a vitamin C drip or some follow-up, I see them in the morning, they see them in the afternoon. Patients or physicians love it. So they got somebody that they can comfortably refer to, and they got a dialogue back and forth so they know what's happening to their patient. Never promise patients systematic health improvements to mercury removal. You just don't. They say, well, am I going to get better? I don't know. I mean, hopefully, I'll do everything I can to help you with that, but I don't know if you're going to get better or not. That's something that you and your physician need to work out. Do all the IMT protocols, or do follow all the IMT protocols, and as I said, they will know if you're not. Trust me on that. And you don't want to do it for your own health. Let's get the mercury out of the environment. Don't have it in your operatory. Used informed consent. Do provide the patients accurate information, including the opposing physician. I got to tell you, I don't do this much. I'm not going to tell them that, just leave it there. It won't hurt. Or, we're not sure if mercury's bad for you. That's something I can say I don't really do much of. Keep accurate documentation that it was a patient's choice to replace the amalgams or have endodontically treated teeth extracted, meaning if that patient wants that root canal tooth out, I'm going to talk to him a little bit, and I'm going to say, look, here's the theory over here, and here's the theory over here, and, what do you want to do? And they say, well, I just don't really think I want to have that tooth. Fine, we'll take care of that. But I don't tell people that come in, unless you've got a, really a nasty abscess on a retreated root canal, I don't tell them they have to have the tooth out. But I will word it in a way that they want to have it out, but I don't tell them to take it out. I've had some colleagues doing EAV in their office and lost their license for 6 months. I believe in EAV. I believe in applied kinesiology, where you do muscle testing. I've got a lot of patients that test themselves on these materials, but there's no science behind this. Even though I think it works, the energy's there. It's true. I think kinesiology, I think, is a wonderful thing, but you can't go to court with kinesiology and there's no science behind it, so you're really up a creek. Like I say, don't antagonize your state board, because they will love to kick you in the head. And the treatment supported by science. That's what the IAOMT is all about. This is my informed consent. Sorry, it's such a lousy picture and not a very complete list there. It's a much bigger page than that. Advertising. This is stuff you guys know. We call ourselves Mercury-Safe. We're not Mercury-Free. When I said that in some publications, the board said, well, what do you mean? You got fluorescent lights, don't you? Well, yeah. Well, they got mercury vapor in them. Okay, so I'm not Mercury-Free. And I'm not anyway, as Joe pointed out. If I'm removing mercury fillings, I'm not Mercury-Free. I am Mercury-Safe, or as safe as you can be. As I said, most of the holistic patients are the patients looking for the kind of care we're talking about. They come in on the internet and they talk to the exhibitors. They find ways to find you through your website. So you want to keep your websites current. You want to keep your listings high so that they can find you, and all the different words that are used for that. I use Equa, which I think has done a fantastic job for us, and that he should be there and should be here as an exhibitor. And please talk to our exhibitors. I mean, we got some great room of people in there that have great products and will help you. The things we've been talking about will be on sale here. Yes, some state boards frown and may not allow Mercury-Free and Mercury-Safe terminology in external marketing. I had trouble with that. Every state's different. South Carolina, according to Joe, is really free and open. North Carolina is a real pain in the butt. So I'm real careful about what I say. But you can get your point across without antagonizing the board. It's not hard to do. Hey, Rich? And it's some of the things I advertise in. Like I said, I do television, I do radio, I do some print advertising. My most effective advertising is the internet. And we have a thing called a smile card, too, I'll be happy to talk to you about. But those two things are probably the biggest, followed by radio. Radio has been very effective for us. And that's talk radio. We don't advertise on rock and roll and not too much on country, but it's pretty much of just a talk radio. That audience seems to have had the kids through college. They got their bills paid. Now they're looking to spend some money on themselves. So it's a very good audience for us. Join DAMS. That's an organization that will funnel patients to you if you're a member and if you're accredited and if you're fellowed particularly. That's a good organization anyway. Tom McGuire's here. He's got a great referral service that will get patients to you. Some of the benefits: great camaraderie. These are my dental buddies. I don't belong to the ADA. I don't belong to the North Carolina Dental Society. So, I do go to a lot of dental meetings, but these are the guys that, we get the hugs from and the handshakes and see each other twice a year and look forward to it. We got science behind us. Our database is incredible. We've just been redone on our website. I encourage you to go to it, and there's more there than you can possibly read. Continuing education. We have 2 meetings a year, always under this format. Patient referrals. The IAOMT will get you referral patients if, in fact, you are accredited, or if you're just a member. I mean, I'm not saying it wouldn't if you're not accredited or fellowed, but the higher up the ranks you go, the better you look. And we have a newsletter. It's not called In Vivo anymore, I don't think, is it? But we get a newsletter, keep you up to date. And we have a website, great website that's just been redone. Better health following safe Mercury protocol, unique practice position, as I talked about, biannual meetings. The next one's in Puerto Rico. Free access to Dr. Tom McGuire's database of referrals and reference abstract articles. We got a clinical practice committee. We've got our mentor that Mark talked about, and he's the chair of that. But if you need help, we're happy to help you. It's surprising how few calls we get, but we're here to help if you want us. I'm on that with Dr. Gilbert. And don't forget, call the mentor. Ask him. We're there to help you. You're not bothering us. We're happy to do this. I'm happy to be up here talking to you. If you're not sure of the legality of what you're doing, technique or something, check with the board, and don't get in trouble with them. Accreditation: you got to take this course, which you've done. Attend 2 meetings. So this one and Puerto Rico, as we showed, will get you in the position to sign up. It's an open book exam. It's not a piece of cake, but you got to know your stuff. But it's just more or less, we want to make sure that you do know what you're doing. You just told us, you just couldn't tell us you know what you're doing. We want to see a couple cases. We want to make sure you got the vacuum. We want to make sure you got the dam on, the clean outs and stuff like that. They're not trying to kill you. They just want to make sure that if you're going to be accredited, that we know you know how to do it. And we're not a policing organization. We're not going to come around and take your accreditation if you don't do something, but we assume you're going to do it. There's an oral interview at the meeting, just to make sure you bring a couple cases and they look through your paperwork, make sure you're doing what you're supposed to be doing. You just submit an application after 2 meetings in the fundamentals. And I think this is still going on. $100 off Tom McGuire and Paul Rubin's DVD, How to Make Your Practice Mercury-Safe, kind of what we're doing today. Minimizing occupational exposure to mercury. And a great training tool for team members that are not at this meeting. This is hard stuff to take back to the team if they haven't been here. You're really changing the thing, what you're doing. And you know how dentists come back Monday morning and they got all this whole new stuff to do, and the team's not on board. It usually doesn't get done. Act today to change your life. Join the IAOMT. That's why I'm here. I'm wanting you to join and get accredited and get fellowed and be part of us. We'd love to have you. And to do that, we'll take $50 off your membership. Now, here's some contact information. You got Joe's on top there. You got me below it. That's our office email, by the way. That's not my personal. And this email below here is actually changed, but you can still get me at that Yahoo address. I've got 2 email addresses. All right. Thank you very much. You've been a great... No, I didn't see anybody sleeping.